My name's Dr Michael Beckles. I'm a consultant respiratory and general physician. I work here in London as an accredited expert witness in respiratory diseases, and I work in a London teaching hospital. And I also run a small private practice where I see international and UK-based patients with respiratory and general medical problems. In my practice, I see patients from sort of 17, 18, right through to the very elderly. I'm seeing more elderly patients these days just because of increased survival, and they have a variety of conditions, from things that are quite benign, like a cough can be benign. It could be the first presentation of something sinister or serious like a lung cancer. But they vary in terms of the ages at which they present and also in terms of their occupations. So I see patients who at the hospital see me, and they're referred from the general practitioner to international patients who fly over to the UK for a specialist respiratory opinion. I think there are a couple of things that are very exciting. So the first is some of the novel treatments for lung cancer. Lung cancer, an awful disease that's often found late, is increasingly common in those who've never smoked cigarettes, particularly young women. And there are some new therapies that are making the giving of the diagnosis of an awful disease actually much better, because we have something to do in terms of a treatment to offer them with long survival. Okay? So immunotherapy for lung cancer is really exciting. Also, there appears to be a new diagnosis of silicosis, so patients who have been involved in not only the mining but processing of materials used in household are doing this a bit like with asbestos without any form of respiratory protection. And we're picking these cases up early now because the awareness is there. And once we make the diagnosis, we can make it at an earlier stage and try to find some treatment for that. Medicine is always evolving, and so in terms of being present every day, that helps me to keep abreast of developments. It means that I have that experience of being on the, if you like, on the shop floor to see things every day. Because even as we have developed with the pandemic, even working remotely, that is a good thing for some, but in terms of seeing patients, examination is really important. And so one of my principles in practice is, even with international clients, is I prefer ideally to see them face to face for the first consultation so that I can meet them, find out a lot more about them, to examine them, and then I can make a management plan. So being there every day is really important to my skills as well as the service that I provide to my clients.